Hello, this is Dr. Emma Hitt-Nichols, and this is the information on the latest U.S. FDA approvals for the week of April 8th through the 12th, 2024. First up this week, the FDA has approved Benralizumab, also known as Fasenra, for add-on maintenance treatment for patients with severe asthma aged 6 to 11 years with eosinophilic phenotype. This follows the initial approval of Benralizumab in 2017 as an add-on maintenance treatment for severe eosinophilic asthma in patients aged 12 and older. Benralizumab is an interleukin-5 receptor alpha-directed cytolytic monoclonal antibody that reduces eosinophilic inflammation, a key factor in the pathophysiology of severe asthma. Severe asthma is a complex condition that significantly impacts quality of life, particularly in children, and can lead to frequent exacerbations and hospitalizations. This condition often requires more intensive management strategies compared to milder forms of asthma. The latest approval was based on findings from the TATE study, an open-label multinational phase 3 non-randomized trial. In this trial, the pharmacokinetics and pharmacodynamics of Benralizumab in children aged 6 to 11 years old with severe eosinophilic asthma were consistent with those observed in prior trials in older age groups. The safety and efficacy profiles were also aligned with previous findings. The approval of Benralizumab was granted to AstraZeneca. Also this week, the FDA has approved 2 new administration methods for Cenobamate tablets, also called Xcopri, for adult patients with partial-onset seizures. These new methods include crushing the tablets to mix with water for oral administration or administration via a nasogastric tube. Cenobamate was first approved in 2019 as an anti-seizure medication, primarily through inhibiting voltage-gated sodium current, although it's also used as a positive allosteric modulator of the gamma-aminobutyric acid ion channel. The drug can be used alone or in combination with other anti-seizure medications. Partial-onset seizures, the condition for which Cenobamate is indicated, is a form of epilepsy where seizures begin in one area of the brain and can remain localized or can spread. Managing this condition effectively is critical as it can significantly impact patient quality of life. The approval of these new administration methods is based on a finding from an open-label randomized crossover study. The study demonstrated bioequivalence between the new administration routes and the original method of swallowing an intact tablet. The approval of Cenobamate for these new administration methods was granted to SK Biopharmaceuticals. Also this week, the FDA's Oncologic Drug Advisory Committee unanimously recommended the adoption of minimal residual disease, MRD, as a new endpoint for the accelerated approval of treatments for multiple myeloma. Advisory committee votes usually, although not always, influence the FDA's final decision. Multiple myeloma is a blood cancer characterized by malignant plasma cells accumulating in the bone marrow and often leads to extensive bone damage and renal failure, among other complications. Traditional endpoints for drug approval, such as overall response rates, require lengthy observation periods and often only show a partial picture of a patient's response to therapy. By contrast, MRD can provide a more immediate and sensitive measure of disease presence at very low levels, potentially allowing for quicker and more adaptive treatment strategies. The proposed adoption of MRD as a new endpoint could reshape the landscape of multiple myeloma treatment, enabling faster introduction of new therapies and possibly improving patient outcomes. The approval of this new endpoint is now pending for the FDA review. The FDA has granted emergency use authorization, EUA, for LabCorp's Mpox PCR test home collection kit for the diagnosis of non-variolar orthopoxvirus infection, including monkeypox virus that causes Mpox in patients 18 years of age and older suspected of Mpox infection. This marks the first authorization for an at-home Mpox collection kit. The Mpox PCR test home collection kit employs polymerase chain reaction PCR technology to detect the DNA of this virus in lesion swab samples collected at home by patients. Monkeypox, also known as Mpox, is a viral disease characterized by a rash and flu-like symptoms. It is less severe but similar to smallpox, which was eradicated in 1980. The recent increases in Mpox cases in the United States have heightened the need for accessible diagnostic options to manage the spread and treatment of this virus. The approval of the Mpox PCR test home collection kit was granted to LabCorp. Also this week, the FDA has approved dolutegravir lamivudine, also called Dovato, for adolescents living with HIV. This approval introduces Dovato as the first and only oral two-drug single-tablet regimen available for individuals aged 12 and older with HIV. Dovato combines dolutegravir, an integrase strand transfer inhibitor, INSTI, with lamivudine, a nucleoside reverse transcriptase inhibitor, NRTI. Dolutegravir works by binding to the integrase active site and blocking the strand transfer step of retroviral DNA integration, which is essential for the HIV replication cycle. By contrast, lamivudine inhibits reverse transcriptase through DNA chain termination, interrupting the viral replication process. HIV in adolescents presents unique treatment challenges, including the need for lifelong therapy. Simplifying treatment regimens, of course, improves adherence and overall management of the disease. The approval of this agent was based on findings from the DANCE, D-A-N-C-E study, which assessed the regimen in treatment-naive adolescents, as well as data from adult trials, including Gemini 1 and 2 in treatment-naive adults and Tango in treatment-experienced adults. The DANCE study showed that a significant proportion of patients aged 12 to 18 years achieved and maintained viral suppression at week 48 with safety and efficacy profiles similar to those observed in adults. The approval of Dovato was granted to Viv Healthcare. Thanks so much for listening today. I just wanted to direct you to the learnamasstyle.com website. That's learnamasstyle.com. This is for medical writers and editors, healthcare providers, people with a science background looking to make some extra income, or anyone looking to improve their medical communication skills, both writing and editing. The website contains several essential tip sheets that you can download, as well as a free course on using AI in medical writing that I just updated, actually, and an AMA-style quiz to test your knowledge. All of these are free and hopefully helpful. Visit learnamasstyle.com. That's learnamasstyle.com. Please do tell your friends about this podcast, new FDA approvals. This helps you stay updated with this burgeoning field of medical knowledge and information. Thank you. Have a great week.